Good afternoon, everyone. Thank you for joining us for our Eastern Region Technical Assistance session. We're really excited that you've joined us this afternoon, that you kind of stuck with it. We know that it's been a long day with a lot of information. We are experiencing some technical difficulties with our director, Kathy Hoke, being able to join us, but she's on the phone right now with tech support, so hopefully she'll be joining us shortly. So we would just like to run this in a really informal way, just like a conversation. We'll take your questions, and to the extent that we can answer them with resources at our fingertips, we will do so. But it also is likely that you might have a question that will warrant some additional research on our part. And so we are happy to do that, and we will get your contact information and follow up with you with some further research that we're able to find. So joining me are our Associate Director, Matt Swinburne. Wave, Matt, and our Senior Attorney, Brooke Torton.
Hi there.
And Megan Greist, our Chief of Staff, is also on with us. And my name is Kerri Lowrey. I'm the Deputy Director in the Eastern Region. And as I mentioned, Kathy Hoke is our Director, and she will be joining us shortly. So at this time, I'm going to share my screen. And we are going to just really briefly go through a couple of slides. Let me see. Do this. Yes, share screen. Sorry, I was not expecting to have to do this. Okay. Sorry for the spinning circle. There we go. Okay, hopefully you can all see that. Thumbs up, right, guys? Can you see this okay? All right. We were told that we needed to kind of narrow the scope of the topics that we could address today. And so we chose these three, COVID-19 and the incarcerated, housing stability and eviction prevention, and food access and security. We work on a lot of other topics, as I'm sure you're aware. And so if you have a question that's not related to one of these topics, we won't kick you out of the Zoom meeting. We'll do our best to address it. Moving on to the next slide, which this is not letting me do, of course. Okay, I'm going to skip this one because Kathy's not on with us yet. So just really quickly, the topics related to housing stability and eviction prevention that we've been working on and will continue to work on long after COVID is a distant memory are issues of rent escalation, which, I mean, I should say that pretty much all of these topics that we're going to talk about are not new. These aren't things that, that happened because of COVID, but COVID really has exacerbated a lot of existing problems and issues, and really shined a light on opportunities for change in law and policy where it needs to happen. So with regard to housing, rent escalation has been a problem for a long time and continues to be. It is contributing to a housing crisis across the country, where failure to pay rent cases are still being filed in courts, even though eviction moratoria are in place and still in many jurisdictions. I think most of you are aware the CDC issued an unprecedented nationwide eviction moratorium on September 1st. It went into effect on September 4th. We will have an entire roundtable discussion about that tomorrow at this time, if you're interested in talking some more about CDC's moratorium. So late fees and penalties are prohibited by some of the state and local eviction moratoria that are in place or were in place until very recently, but not in all jurisdictions. So for example, in the national moratorium that I just mentioned does not place a stay on late fees and penalties from accruing. So come January 1st, all back rent and late fees and penalties for non-payment will come due, which is an obvious problem and contributing to the housing crisis that we're seeing. Right to counsel is a major issue and has been for a long time. We know that when people are represented in court, their outcomes are better, and this is well documented in housing cases, particularly landlord-tenant cases. And there are a number of legal approaches to ensuring right to counsel for tenants in landlord-tenant cases. Most of the research shows that while landlords tend to be represented about 90% of the time in rent court, about 90% of tenants are not represented and they're pro se, which leads to bad outcomes for tenants. And then finally, public access to court filings. We're an open government society, right? And that's a good thing, we should be. But in cases of landlord-tenant cases, particularly in a pandemic like we're in right now and in a housing crisis, the fact that future landlords can look back and see that there has been an action for failure to pay rent or a judgment against a tenant for failure to pay rent or even a prior eviction has a chilling effect on people's ability to get housing in the future. And so, you know, there's some talk about maybe changing, you know, how freely accessible those records are. We do have sample resources on the network's website. These are just a few examples. There's a webinar on state and local government actions to address housing insecurity. I wrote a blog post, or as we call them now, law and policy insights recently on the CDC's eviction moratorium order. And there's a really good video on there on racial residential segregation and health justice. And we are also involved in a policy initiative right now to provide eviction prevention services to tenants in the state of Maryland. And so with that, that was a quick and dirty because we want to leave a lot of time for your questions. I will hand things over to Matt, who will talk about the work that he's been doing in food security.
Hi, I'm Matt Swinburne, the Associate Director, and one of the areas that I do a lot of work in terms of research and technical assistance is food security. And of late, you know, my work has really focused on the efforts to address the increase in food insecurity brought about by COVID-19 and the economic troubles that it's created. So there's been a broad spectrum of government interventions to deal with that. Did a webinar earlier this summer on some of the initial efforts, and I can go into that if folks have questions about what the government has been up to trying to address this problem of, you know, an additional 17 million people being forced into food insecurity as a result of the pandemic. I do a lot of policy work around the SNAP program, the Supplemental Nutrition Assistance Program. And that's actually, tomorrow I'm speaking on how SNAP is being used during the pandemic to better meet the needs of food insecure folks, and some of the things that should be done to make it a better tool in dealing with this public health crisis. We've done work with the school nutrition programs, looking at things like how addressing the breakfast gap, you know, the fact that children who are eligible for free and reduced price breakfast are not taking advantage of it, and how school districts and states are trying to narrow that gap. Looked at key programs that are being utilized now, the seamless summer option and the summer food service program, which are the programs that are activated right now to feed children while the schools are closed down. I've started to do research into Native American food security programs. So things like the Title VI program under the Older Americans Act that helps senior Native Americans with their food security needs, as well as the food distribution program on Indian reservations. That's kind of a parallel program to SNAP. It's an option to participate in that rather than in SNAP. but I've dealt with a broad spectrum of food policy issues. And, these are just some samples of resources that I've created or I've created with my students at the University of Maryland Law School. Some of the things, aren't obvious issues for folks, but, for example, we have a resource that looks at the effects of denying individuals SNAP under the federal ban on individuals with a drug felony, and kind of the interaction of state and federal law there, and what the public health impacts are of legal policies like that. So these are just some samples of the work I do in the arena of food policy and food security. But as Kerri mentioned, we all kind of have our hands in a wide variety of cookie jars, so to speak. So, yeah, I guess Kerri, you can share the slides with who's ever next.
All right. I pressed stop share.
Okay.
And I thought that maybe we could open it up at this point and see if there are any questions from attendees on any of the information that we've shared. And then when Kathy's able to join us, we can talk about incarceration. So I'm not sure how that.
I'm not, where is the chat for this?
This is just, wait a minute. Okay, so Matt, you don't see my screen anymore, right?
I don't see your screen anymore.
But I don't see anybody else. So let's see.
There is one question. This is Anna. There is one question in the Pathable chat on community health and behavioral health workers. So it's not on the topics, but I'm happy to read it if you'd like me to.
Sure.
Well, CMS and IHS both support the development of community health aides workers or behavioral health aides. These services are not congressionally mandated to be in state plans for Medicaid payment. Wyoming does not wish to expand Medicaid to pay for these workers statewide. It isn't in the state plan, and also feel they cannot do it for the American Indian Reservations Tribal 638 health programs, for which 100% FMAP is provided by the federal government. Any suggestions on how to obtain a federal fix to allow for Medicaid reimbursement? Or CHWBHA, whose work is even more important in this COVID-19 and post-pandemic environment? Big one.
That is a big question and a really good question. Matt and Brooke, I don't know if you have anything to add, but all I would say is that is a question that is right for our colleagues in the Southeast region who specialize in managed care, Medicare, Medicaid policy, particularly through our colleagues who were with NHELP. So I would field that question to them. And so, Anna, I don't know how you want to handle getting people's contact information, but I would be happy to send that question on to Sarah Summers, who I think could probably answer it in 5 minutes.
Yeah, so we know, I have the name of the person who asked it and whatnot, so we have her email and we can coordinate that after the summit.
Great, thank you.
Mm-hmm.
Are there any other questions on the housing or food security stuff? Brooke has left us, or else I would have her talk a little bit about the work she's been doing on threats to health and safety.
I'm going to just.
Okay.
So I am here kind of on the side with Kathy, trying to make this work. I think ultimately what we may do is we're going to see if she can log in as me and talk about that part, or I may just hold up my phone so that she can speak on the decarceration work that she's been tracking. So give me just a moment. I'm going to turn for just a sec and see if.
Thank you for your patience, you guys. This has been a test on all of us, right? Of our technical abilities, of our patience, of our ability to go with the flow. Anna, any other questions in the TA box? I don't see any on my end, but I didn't see that first one either, so I think something is.
Okay, I am going to turn this. So if we can just, if someone can turn the share screen back on, and I'm gonna hold Kathy up
Yes, ma'am.
to the screen here. So hopefully we can hear. Okay.
All right, 1 second.
Not if you can hear me well enough. But I can't see you because I only see.
We can hear you well enough, Kathy. Okay.
You can, you cannot.
All right, I am sharing my screen. Let's see,
Okay.
from the start. Let me go to your slide. There you are, Kathy. Can you see it?
Thank you. Well, let me apologize because there's tech people trying to figure out how to get me in as a presenter, but it doesn't seem to be working. So, yeah. Brooke, did you just mute yours? No, okay.
I can hear you, Kathy. I can see your left ear.
Okay. Can you guys hear Kathy?
Yep.
Yep, they can hear you, Kathy, but you probably can. Okay.
So I apologize. Who knows why it's not working, but here we are in this situation, and so we'll make the best of it. In any case, welcome to the Q&A session for the Eastern region. I wish that you could, thank you, Anita, for saying you can hear me. I can see that now. So I wish that I could, you could see me, but Brooke is a far more attractive person than me, so you get to look at her instead of me. But I'm the director of the network's Eastern region and have been with the network since we started just a bit over 10 years ago now, on September 10th of 2010. I just realized that that anniversary had passed. So the issue that you can see the slide up in front of you, the issue that we have been taking a look at in this COVID context is not one that we were working on, during other times. Housing obviously is an issue that we've been working on in the Eastern region, and the food issues we've been working on. But with respect to the incarceration, that's not an issue that we had really been working on. But there's so much to look at here that we decided we had to jump in with both feet. And so the first thing you'll see on the slide is really the federal efforts with response to how to manage incarceration issues under COVID. As you might imagine, they are tremendous with respect to rapid spread once anyone in the prison context is infected. And so first, the CARES Act funding included $100 million to the Federal Bureau of Prisons to cover correctional employee overtime, personal protective equipment, personal hygiene supplies like soap and the like, as well as testing kits so that there could be routine testing. Even at that number, that is, a woefully inadequate amount of resource to be able to really protect all of the incarcerated individuals, as well as all of the staff, and then relatedly their family from exposure to COVID in incarceration. The Federal Bureau of Prisons did also take action to reduce the prison population through some early release programs, but frankly, they were minimal effectiveness in that a very few, maybe 1,000 inmates were released in this way, but that's a drop in the bucket as compared to the number of incarcerated individuals, still in federal prisons. And then you can see that the Department of Justice under Bill Barr directed some of the prisons with the highest rates of COVID infection, typically situated in the states where there were higher rates of COVID infection, to prioritize release first of older inmates, and then he expanded that to a broader category of at-risk inmates. And so we did start to see prioritization of early release, expedited release, so folks who were coming within several months or a year of what would have been their discharge date being expedited to early release. But again, those numbers are still rather modest. Similar activity at the state level, but coming from either courts or the governor's executive orders or through agency regulations or policies establishing early release parameters. And again, very similar to the federal, looking first at health vulnerable inmates and older inmates who fall in the category of particularly vulnerable to COVID. And so that's for inmates, people who have been convicted and are incarcerated. At the state level, we have seen a lot of effort also at releasing pretrial detainees. So folks who may be incarcerated because they're pending trial and they weren't able to post their bail, and which really supports the notion that cash bail, that bail is inequitable and shouldn't be imposed in any case. But at many of the states, they're looking at those pretrial detainees differently and being more aggressive about releasing pretrial detainees on their own reconnaissance when they were otherwise being held at bar, because of bail. And then also trying to reduce the inflow of detainees or individuals to be incarcerated at the state level. So state courts have issued various orders, often with a great deal of discretion in the trial courts as to how to implement the rule, but essentially looking for alternative means, whether an individual could be on home confinement or some alternative sentencing that doesn't include putting them into a jail. And so we see varying success there. I will say in Maryland, there was a very thorough evaluation or court observing that went on with some of my colleagues at the University of Maryland School of Law and the University of Baltimore School of Law that looked at, under our court's order in Maryland, whether this was going to reduce the number of pretrial detainees that were incarcerated. Would judges be more inclined to grant release on their own reconnaissance or the like? And the fact of the matter is there seemed to be very little to no movement in that direction. And so these orders, because they still just simply allow discretion in the trial courts, the orders are only as good as they are being implemented. And for whatever reason, courts by and large, in Maryland at least, were not really changing their practices with respect to pretrial detaining. Again, for both the federal and the state provisions, the typical focus for an early release would be on nonviolent offenders, particularly people who are in on a technical parole or probation violation, having maybe missed too many meetings with their probation officer, testing positive for alcohol or drugs or the like, and so nonviolent, but technical violations, and then also the medically vulnerable. So that's really the efforts that have been taken to decarcerate administratively at the federal and state level. And then from a litigation perspective, because, as I've indicated, the inadequate effectiveness of the efforts to reduce incarceration, there have been several cases filed against both federal prisons as well as state prisons, and some locals, where they are typically class actions. The relief that the inmates are typically seeking, some are seeking release, particularly for the medically fragile or older inmates, but often they're seeking for an injunctive provision that requires compliance with CDC best practices, or even some heightened standards because of the known rapid nature of infection throughout an institution like a jail. And so we're seeing very little to no success in these class actions as far as preliminary or temporary injunctions. So we'll see as they move through the courts. One thing, the network, I say stay tuned. We have been capturing all of the executive orders and tracking the litigation, as well as others who have been tracking the litigation. We will ultimately produce some fact sheets and other a chart for the network's website so that you can see what actions states took towards decarceration during the pandemic, as well as what the litigation and how it's progressing. But from an academic or intellectual curiosity perspective, it'll be interesting to see if any of the case law pushes at the boundaries of Eighth Amendment jurisprudence. To have an Eighth Amendment claim of cruel and unusual punishment is an extraordinary case. They're difficult to win, but there's some question as to whether there's softness in expanding what the boundaries are of the Eighth Amendment, particularly in such a crisis that we find ourselves in now. So I talked for probably longer than I should have, but I guess that's in lieu of me not being here earlier. And I can see the chat box, so if people ask questions in the chat box, I will be able to see them, but I turn it over to you all, I guess, for questions that you have. And you can ask the Eastern Region questions that are not on the topics that are the slides that we presented here. We just thought it would be nice to pop some stuff out so folks knew some of the work that we were doing, but we can really, if we can't answer today, we will answer later any questions that you have. And I'm sorry, I know there was a question being discussed earlier. I was trying to fix the technology at that time and didn't capture the question, but I'm sure we'll get back to whoever it was ultimately.
Thanks, Kathy. I'm going to stop sharing my screen. There we go. Okay, so what are the questions in the chat? Let's see. Can you see the questions, Kathy? Because I can't see them. Or Anna?
Kerri, I think Kathy can see the questions. It doesn't look like there are any coming through right now.
Okay.
I just made a comment that she could hear me, which was lovely. And my early on test to make sure even that was functioning, but there's nothing there.
Look at that. Kathy is coming through loud and clear. Fantastic.
Yeah. Oh, here's Matt. Matt, do you know of any advocacy efforts lawyers or policy folks can engage in to assist with the looming eviction crisis? So that's actually Kerri. Kerri, do you know of any advocacy efforts lawyers or policy folks can engage in to assist with the looming eviction crisis?
Oh, yeah. I mean, I don't know where the person who's asking the question is from, but there are, in Maryland, there are several. Wherever you are located, if you're an attorney and you're interested in taking on pro bono cases, for example, filling in that void that we talked about earlier about representation for tenants, especially once the national moratorium is lifted come January 1, and you'd be willing to serve in a pro bono capacity. Every state has, check with your bar association to figure out how you can be connected with tenants who need representation. Here in Maryland, Maryland Legal Aid, so I'm sure legal aid organizations, throughout the Eastern region. What else? Like Homeless Representation Project. I'm sure that there are similar organizations like that throughout the Eastern region as well, but it would help to know where the requester is from. And then I can do a little bit more digging for you and connect you with the right places. But there are efforts because people are just seeing the housing crisis that we're in and seeing what's going to happen come January 1. And so there are efforts popping up all over the place that you can get involved with. And thank you for your willingness to do that.
Well, I'm going to while folks are thinking of other questions that they may have, I'm going to take the liberty to, Brooke, highlight your roundtable tomorrow. And Kerri, a question came in. Oh, Pennsylvania. So let me go back to Sophia Mitchell, our question person, and then I'm going to highlight the roundtables for tomorrow. But Sophia is from Pennsylvania, Kerri, so we can take a look there. There may also be other law schools. It's not unusual for a law school to have a housing clinic, and so maybe some of her colleague law schools would have some thoughts here. But she said non-litigation policy advocacy recommendations. So, I'll speak to this briefly and then turn it back to Kerri. I will say, for example, one example of an interesting litigation, but really a policy advocacy recommendation is we do know that having a lawyer representing the tenant in an eviction proceeding alters the outcome almost every time. Much more favorable outcome for someone who is represented by a lawyer. And so allowing, seeking a policy change for recent law school graduates who are not yet admitted to the bar, and frankly questioning when they will get admitted to the bar because of problems with the bar exam. I actually don't know where Pennsylvania is with that. Or second and third year law students for a clinical program, but with some training, could be representing these individuals in court. Kerri and I, as Kerri mentioned, we've been educating our students on how to do this, and frankly, we could do it, and they could do this not with that one-on-one supervision that they're getting in a clinic like with us, but I have a high degree of confidence that with decent training. So really it requires change in the practice laws, which are typically governed not by the legislature, but by the courts. And so in Maryland, it would be advocating before the Court of Appeals to have at least a temporary practice provision for, again, it could be third-year law students, recent graduates who are not yet barred, folks who are barred in other states, but not in Maryland. But many people practice and aren't barred in the state where they are because they're not doing direct representation and the like. And so really just trying to find ways to have more lawyers available to the tenants who are coming before the courts. That was my initial reaction, is loosening up those practice laws. Kerri, I don't know what kind of non-litigation but policy advocacy ideas you might have for Sophia in Pennsylvania.
Yeah, so I have to do some research to find out what organizations she could connect with, but obviously the right to counsel thing is huge, and it's an effort around the country. So I wouldn't doubt that there are organizations in Pennsylvania that are working on right to counsel policies, like changing practice rules and advocating for public funding of legal services for tenants. Also, rent stabilization legislation. We talked about rent escalation being a major problem even pre-COVID, and it's just exacerbated now. Policies like tenancy preservation measures, like forgiving those penalties and late fees that we talked about earlier. Also, we talked about public funding for legal representation for tenants, but also funding to assist small landlords, who many of them rely on the income from their properties to not only for their own livelihood, but in order to keep those properties lights on and to keep them safe and healthy for people to live in. And so policy advocacy for for public assistance in those areas is really important. So yeah, but I will look into what organizations in Pennsylvania are doing this work. We talked about the privacy stuff, and just expungement of prior eviction judgments is also another policy issue that's important for safeguarding people's ability to get rental properties in the future.
As you were talking, I thought of another one that isn't necessarily related to COVID and to eviction, but really about getting into safe and affordable healthy housing, and that is through provisions that prohibit landlords from discriminating against tenants based on their source of income. There's what's often called the Home Act, and the Housing Opportunity, and I'm blanking on what the M and the E stand for right now. But for example, in Baltimore County, Maryland, landlords are not permitted to not rent to you because the major source of your income is alimony, or the major source of your income is public benefits. And so it opens the doors to properties that folks who typically on public assistance might not have access to, because landlords, as they testified against it on the hearing, quote, don't want to deal with having to get the money from the federal government, even though the system is set up to be pretty effective, and there's a virtually guaranteed payment. So advocating for no discrimination based on source of income would be a worthy effort in Pennsylvania, no doubt, Sophia. I see another question come in. So this is for Matt. What, if any, innovations in nutrition programs have you seen to address food insecurity in the time of COVID? Matt?
I was muted and I started talking.
I can't see, so
I dropped all my knowledge in those 5 seconds. There are dozens of nutrition programs that are being brought to bear to deal with this tremendous increase in food insecurity. You know, a lot of the existing programs like SNAP and WIC and the child nutrition programs like the school lunch and school breakfast program are being modified so that they can better function under the challenging conditions of the pandemic. So I could talk for hours just about those, but in terms of programs that are, you know, not a modification of an existing program, there have been a couple interesting things that come to mind. One was a USDA program, the Coronavirus Food Assistance Program, where as part of this, the USDA announced a farmers to families food box program. And this really came about from what was happening early on in the pandemic with the shutdown of the commercial kind of food chain, you know, with restaurants being shut down and, you know, institutional cafeterias at like universities. The farmers who provided food for those food chains had no one to sell their food to. And so there was a lot of food being wasted. And at the same time this food was being wasted because it was being tilled back into the ground, or milk was just being dumped because there was no way to get it into the chain of commerce, you had millions of people struggling to find enough food to eat. And so this program, I think the motivation and the basic idea behind it are really interesting. The USDA set out initially to commit $3 billion to purchasing food from these farmers and then distributing that food to food pantries and food banks because, you know, during the pandemic, these community resources have been slammed where they don't have enough food to meet just kind of the tidal wave of people that are coming to them for assistance. So it was trying to take that food that was being wasted or could be wasted and getting it to the folks who need it through the kind of food pantries and food banks across the country. And the way it worked is the USDA would essentially contract with food distributors who would then contract with the farmers and assemble the designated food boxes that would then be delivered to food banks or food pantries. And so it was really, I think, you know, the idea was a strong one because you're dealing with the issue of food waste and getting food to people who need it while also getting, you know, employing farmers, employing folks who work in the food distribution chain who have lost work because of the impacts of the pandemic. But, you know, this has had some issues. You know, looking at the critiques of the program, there were some companies that were awarded these contracts who it was a, you know, questionable whether or not they had kind of the experience and capability of fulfilling on that contract. So there were some problems with some of the contracts that were awarded, and I know some contracts were actually revoked. And then another issue that's been brought up is, you know, cost effectiveness, that in this program, they are not, you know, from a food security perspective, they're not getting the best bang for their buck in terms of those government dollars are turning into the most amount of food to those in need. So there's been some critique that there's some inefficiency there. But then probably the third and another concerning critique is that how they match this supply to demand really doesn't have a game plan of connecting those most in need with these resources. The way that this food is distributed is, in the program is that the food distribution folks who contract with the USDA use their existing contacts in, the food bank, food pantry world and connect people they already have contact with these food boxes. Or these nonprofits could reach out and connect with the distributors. There was no mechanism in place to determine, well, this community is the hardest hit. We need to make sure that this community is getting its, fair share of these resources. And this program has gone through or has entered its third phase of, essentially contract or grant awards. And in this last phase, which is meant to cover food distribution of these boxes from September through the end of October, they've put a preference measure in place. So for the awarding of these contracts, they have to demonstrate that they would, the kind of final delivery of this food would be to opportunity zones, which is a term used for low-income census tracts that's used by the Secretary of the Treasurer to kind of shape tax incentive policy to encourage investment in distressed communities. So through this, they're trying to, I think, react to some of the criticism that you weren't getting these resources to those most in need. So in this third round, they're trying to put that as a preference in the awarding of the final bit of money. But because this program was politically popular, President Trump allocated an additional $1 billion to the program just last month. So it went from being $3 billion to spend on this food to $4 billion. So I think it's an interesting, kind of policy intervention that deals with a lot of different challenges that are being experienced right now. But, I think the mechanics of it could have been better. But then again, this is all done, in a short time frame to react to immediate needs. So that's one that really jumps out. And I realize I probably talked way too much on one thing. I can keep going on other stuff unless there are other questions.
Well, Matt, another question did come in, so I'll ask that one out. It says, have you done any research on the COVID vaccine? Any idea when a viable vaccine might come out? Also, expecting that there won't immediately be enough for everyone, will there be priority groups who get first access? So if I knew the answer to that question, I'd probably be richer than I am right now. But I would be buying certain stocks. But no, all joking aside, I mean, the administration has put into place what they're calling Operation Warp Speed, which is some modifications to the FDA's regulatory process for approval of vaccines. So there will be some, I suppose we could call it cutting of corners, or less rigorous trials or length of trials that one might otherwise see for a vaccine. So it is possible that a vaccine, I believe it's highly doubtful a vaccine will come out by the end of October, as the administration has suggested. But in any case, I think eventually there may be a viable vaccine. Just today, the federal government put out what they're calling the playbook for the states with respect to the complex process of vaccine allocation. Again, it came out today. So if anyone's interested, and I can send you the link to it. So there was both a briefing to Congress as well as a distribution of this playbook to the states. And I will say, my initial, I just was only able to glance through it pretty quickly today since I've been here at the summit. But it just speaks to how complex this process is going to be, and it really isn't much direction in there, or answering any of your questions about, okay, who will we allocate, how will we allocate, but really acknowledging the complexities, hearing that we may not know until there is a vaccine or vaccines as to who it makes sense to actually prioritize. There may be populations that it makes sense to distribute to and not others. So maybe we don't want people 3 through 17 or 3 through 10 or over 75 to actually be some of the first recipients. If there are questions about having run through the process more rapidly or the like, or if there are any known side effects of the vaccine that are known, to be more significant in certain populations. So I think the big task ahead is we've always had systems in place, crisis standards of care across the country at the state level for what to do when we have, scarcity of resources. Sometimes as simple as flu vaccination, who's going to get it if there is, limits. But here it's going to be, extraordinarily limited at the outset. I will say the federal government does indicate in the briefing to Congress that the vaccine will be free, with the exception of for Medicare recipients. That appears to be costing them $3.50 for the vaccine, which I don't know where that number comes from, but there would be a modest cost to Medicare folks. But free for everyone else. And there is what's called the Provider Relief Fund that they're contemplating. I don't know where they are in the process of creating it, but to fund it in excess of $1 billion to reimburse healthcare personnel and facilities that would be administering the vaccine, since it would be free. I imagine some of that would have to go to insurance companies and the like if they were covering any parts of this. So I think we're not going to be ready if the vaccine comes out anytime soon, but there are really smart people, hopefully with an ethical lens and a safety lens, looking at the distribution question. I'm scrolling to see if there were any more questions. What I wanted to highlight earlier, and so I'll just throw it out there, and if folks, again, if you have any questions about anything, don't wonder if we can answer it. Just put it in there, because if we can't answer it now, we can answer it later. And that's kind of the whole principle of the network. People tell me, I don't know if you can help with this, but I say, I love that you called me when you didn't know if I could help you with it, because 9 times out of 10 we can, but the whole concept of the network is we're going to find just somebody who can, though. That's why it's called the network and not just us. In any case, to highlight 3 sessions that are upcoming, one would be tomorrow, actually, Matt and myself. Matt, we are at, I believe, 1:15, right? 1:15 to 2.
It sounds about right. I'd have to.
Yeah, sounds about right. I'm going to have this little problem fixed before then, that's for sure. So Matt and I are going to be talking about particular issues in COVID affecting essentially families, and Matt's focus will be, as it always is, on food. And if you knew Matt, you'd know how appropriate that was. And I'm going to be focusing on the school closures issues and how school systems are or are not meeting their obligations under federal disability laws and education access laws during the closure. So please join us for that tomorrow at 1:15. And then during the end of the day tomorrow, I think during this same time period, the 3:45 to 5 o'clock window, there are what's called networking sessions. That's how they appear on the agenda. The funny thing is I'm actually doing air quotes like you guys can see me, and it's funny to me that you're seeing, right? In any case,
I can do it for you.
Seeing the whole time. Yeah, thanks. I even put on makeup today for you guys. But Brooke is going to be doing a networking session on a really interesting project that we've taken on in collaboration with the National Association of City and County Health Officers, NACHO, and that is looking at state laws that provide protection against or assault to public health officials in their official capacity. As you know, around the country, there have been many public health officials who have left their jobs or who have felt threatened and really suffered tremendous threats against themselves, even health departments that had to shut down for periods of time because of credible threats that made it unsafe for employees to come into the building. And I don't know, Sophia, if you're still on, but in Pennsylvania, Dr. Levine, who is phenomenal, has certainly been the subject of some rather harsh treatment, throughout many of the communities who are opposed to any of the public health measures that she is supporting and putting in place in her capacity as the Secretary of Health. So tune in to talk with Brooke about, what laws do exist, what their limitations are, and what states who are interested in, now that we recognize the sad reality that folks who are often in the background, if they're doing their job and it's going well, no one notices that they're there. And then when there's a pandemic, all of a sudden they're thrust into the spotlight, but how we can better protect them, frankly, so that we can keep quality folks in their jobs and have the community better understand and respect the role that public health officials play during times of crisis. And then Kerri's going to be doing a roundtable on the CDC eviction moratorium, which, if we had 3 days, we would sit here and try to work out the legal intricacies of that. I'm not sure the CDC has the authority to do what it did in that moratorium, but and there have been court challenges to it that Kerri could discuss during the roundtable. But for right now, it's in effect, and so how can we take advantage of that during at least the period of time that it is still in effect? So I encourage you to tune into those. So I do see another question. I'm going to pop this one over to Matt. If a person has a medical marijuana card and is applying for a job that requires a drug test, will testing positive for THC prevent them from being able to get the job? And this is specifically asked in Virginia, but I don't know that you know the Virginia law.
I would have to go and look at Virginia's law because this really is an issue of state law, because some folks think that if it is medical marijuana, it'll be protected under the Americans with Disabilities Act at the federal level. But it's not, because there is an exclusion under the Americans with Disabilities Act that specifically states that, the use of a controlled one substance can never be protected by this provision of law, and marijuana is still a Schedule I substance under federal law. So I would have to go and look to see if Virginia, with its state equivalent of the American, some states have, kind of their own equivalent to the American with Disabilities Act and have incorporated, the use of medical marijuana, or if, they have a separate provision that specifically deals with this issue of employment and testing positive for THC when you're a medical patient. So that's something I'd have to go into the books and see what their specific policy was. There are states that have that protection, but it is a challenging provision to get passed. I know that in the state of Maryland, it's been a legal issue that's been brought up several times, but has not successfully passed, because you have, these two kind of forces at play. You have kind of the desire to recognize, cannabis as a medicine and as a part of kind of a parallel healthcare system at the state level, and that would push into the direction of protecting employment for individuals who use it. But at the same time, there is pressure from businesses and employers who don't want to lose the ability to kind of control their workforce on this issue. So they have a loud and powerful voice in state legislatures. So it's, it's a challenging issue at the state level, I think, and it's something that needs to be addressed so that, you're actually practicing what you're preaching, so to speak. If it is a medicine, like, if your state has said it's a medicine like any antibiotic or steroid, or, it's treated the same way. And with these state laws, it's never that you can't get in trouble at work for being impaired while you're at work, because, the whole issue is with medical cannabis, you know, the active chemicals in that can remain in your blood system for a while. You may not be impaired, but you're still potentially going to test positive on one of these. So, you know, there's some interesting, you know, issues related to that, but I would be more than happy to research Virginia to see what Virginia's approach to that is.
Thanks, Matt. I have a question for you, Brooke. So I'll try to be quiet so I'm not rustling in the background. Now that the pre-market tobacco application deadline, so that deadline by which vaping manufacturers had to file with the FDA for approval to or authorization to have their products on the market has passed. What is the legal status of vape products? Are they all legal or are they all illegal? What's the standard there?
Sure. So I think saying legal or illegal probably isn't the right way to categorize this. So back in 2016, the FDA published a rule which extended its authority to, it extended the definition of tobacco products to include items like electronic smoking devices. And what they said is that if their products, these electronic smoking devices, if they hadn't been commercially marketed as of February 2008, then these manufacturers are required to submit a PMTA, pre-market tobacco product application. So none of these products were commercially marketed, these electronic smoking devices, as of that February 2008 date. And so technically none of them would have been able to be sold, but what the FDA said was they were going to give enforcement discretion and allow all of these companies to get their applications in by that, what was it, September 9th or 8th, September 9th date. And so now the companies that don't have those applications in, the FDA has said that technically they could go out, they could enforce, they could remove these products from the market, those who have not submitted applications yet. The rest of those companies who have submitted the applications, they're going to make their way through those and either you know, grant or deny, and I'm not sure exactly how long that process is going to take. I don't have an estimate on that. Kathy, anything to add to that?
Nope, I think you got it right.
All right. And that was by our very own Blair Ennis, who works on all of this material, and we're appreciative of her.
I don't see more questions coming in. I didn't know. I had one thought that when we talk about a lot of the issues, and it's really actually throughout the conference, but here today, is a lot of the changes that we're seeing being put in place, you know, in the law, the eviction moratoria and protection for tenants, the expanded access to nutrition benefits and innovative ways to get food to people, and the, you know, kind of decarceration approaches, releasing individuals, you know, nonviolent offenders, you know, et cetera, and not incarcerating people for technical parole or probation violations. That these are all policies that public health would promote in good times. Here we are in bad times, and they're being put into place as emergency measures to response, you know, in response to the crisis. But I dare say there are many policy changes that are taking place that could become permanent, the good ones, right? So thinking about, you know, SNAP beneficiaries allowing to have food delivered to them and having that be covered, even the delivery charge in their SNAP benefits, how that would advantage, in particular, not able-bodied individuals, you know, or people who live in a food desert and don't have, you know, effective transportation. Looking at, you know, eviction policy, you know, differently, and protecting tenants from being, you know, removed from their home. And then, you know, if it's safe right now for people to be released, you know, earlier than their time would come, or to not be detained before trial or for a technical violation of parole or probation, it's always safe for them to be in the community. And so my hope is that one of the outcomes here is that we see some of these policies stick in place. I will say there have been policies that we hope are not, right? So the closure, for example, of clinics that were providing reproductive care for women in some states, taking advantage of the circumstances to reduce or eliminate access to abortions. That would not be something we would want to see persist. And but at the same time, so I say to any folks who are on the phone who are researchers, but a happy accident that we're going to have real life experimentation on these policies to see whether and how they had an impact. Yes, an impact during a pandemic is different than in other times, but I encourage folks who are in the research fields to take up those questions, because it will help those who are advocating for these policy changes to become permanent. Question for Kerri. Have we seen legal challenges to the CDC's eviction moratorium?
Yes. We have. The first one was in Georgia, actually, and it was a landlord who's based in Virginia, and he brought action, Brown v. Azar, on a number of constitutional grounds. We will talk about all of them during our roundtable tomorrow, so I would welcome you to come to that. We'll talk about all of them, but there are a lot of issues. Does the CDC have the authority to do this under the both the regulation and the federal statute that they cited their authority to do it under? And does this constitute an uncompensated taking by the government? A host of issues like that. And so we will go through the challenges that were brought up in Brown v. Azar, and I will also talk about a few of the other complaints that were filed since this one was filed, and the grounds that they're alleging that this is not constitutional. But it's really interesting stuff. It's kind of a catch-22 for housing advocates, because we are really happy that this nationwide eviction moratorium is happening, and it's probably going to protect a lot of people from being kicked out of their homes by the end of the year. But it's kind of oogie when you think about the executive being able to have this kind of power over a public health policy. So it's a very interesting tension as public health lawyers that this is forcing us to sit in.
Yeah. Not seeing any. I'm not seeing any other questions pop in, and we have about 13 more minutes. I know my colleagues could talk about anything, anytime in public health, but I didn't know if there was anything that you guys, we were limited in the topics that we were going to discuss today affirmatively, but is there anything that you wanted to mention that you're working on for the audience?
This is all I'm working on right now, that. In my old life, I did a lot of work in injury prevention in kids, particularly sports and recreational injury prevention. So if anybody's, still thinking about youth sports concussions and TBI policy, returning to school after concussion, I'm still very interested in those issues. I just have no time to think or write about them anymore at the moment. Thank you, COVID.
Could be an interesting other, positive outcome of, sports being canceled. I mean, they're negatives, right? Maybe lesser, cardiovascular health, et cetera, but fewer concussions because they're not running around hitting each other. I mean, so my children were still able to participate in some of their sports, but in a non-contact way, right? So they got the cardiovascular, the social, kind of experience, but without, obviously much reduced risk, both for COVID exposure, but also for injury, particularly concussion. So something that could potentially be covered. I'll also say Kerri works very intently with the National Association of School Nurses. I'll touch a little bit on the role of school nurses perhaps tomorrow during the school closure discussion, because NASN has really been trying to find the best way for school nurses to step up at this time and be able to support their students when they're not able to actually see them in person. Matt, anything you wanted to touch on?
I talked a little bit at the beginning about the work I'm doing on, food policy issues, but surprisingly, I also do a lot of work in cannabis regulation. So it's food and cannabis policy. Things continue in that world. It's a rapidly evolving field of law that is complex and interesting because it involves, involvement at all three levels of government, federal, state, and local, and those levels don't always have the same legal policies or objectives. So, I'm always happy to do some technical assistance in that area. I'm currently developing a course for the University of Maryland's School of Pharmacy on the regulation of cannabis, which is fun. So yeah, a lot of different issues. Kathy and I put out a journal article a little earlier this year looking at social justice and equity in the cannabis industry, looking at, kind of the stark contrast between the impacts of the war on drugs and then the lack of inclusivity in the industry once it's legalized at the state level. So what are states doing to make sure that people of color have opportunities in this new, very profitable industry? And how are states using this new income stream of, the fees and taxes from the various cannabis programs to reinvest in the communities that were really harmed under, this country's drug policy. So, taking kind of this new economy and reinvesting it in the communities that need it. So, I think there are a lot of interesting things going on. So yeah, folks have questions, reach out, and I'd be more than happy to answer questions and help however I can.
Thanks, Matt. I will also promote your three-piece or three-part blog series on food access in the Native American community as well.
You mean my policy insights? I don't think we're allowed to call them blogs anymore.
Oh, sorry, policy insights. Are all three pieces up now, Matt?
No, just the first two. The one dealing with the food distribution programs on Indian reservations and Title VI of the Older Americans Act that provides nutritional support to tribal elders. The third piece will be on the food sovereignty movement on Native lands to kind of, take more control and have more independence in crafting, a food system that better serves their needs. So that will hopefully be out in the next week or two.
Thanks, Matt. What about you, Brooke?
So until relatively recently, I've been working primarily on tobacco-related issues, tracking what's been going on at the federal level. We work really closely in another capacity with local health departments that have questions, specifically in Maryland. But a lot of times people want to know what's happening at the federal level and whether or not that would impact them at the state level. And like I said, in 2016, the FDA, they did publish their rule, which expanded their authority and included electronic smoking devices in the definition of tobacco products. So since then, there's been significant litigation we've been tracking. and all other kinds of issues, enforcement guidance that we've been kind of analyzing as that's been released. You know, the use of electronic smoking devices by youth, that's been declared an epidemic. So that's been a huge issue, a huge concern. And then the other piece that I'm working on that I'll be discussing tomorrow during the session during this time is tracking and analyzing criminal statutes that would punish those who are intimidating, threatening, and really thwarting the ability of public health officials to do their job really during this pandemic. And so what are we seeing with nationwide, and then could these statutes be used to protect them? So I'll provide some more detail about which states have what, and then specifically the elements of these statutes, and that'll be tomorrow. And I'd really love to hear from people about what they've experienced and what they've seen, and whether there are other protective measures that or should be included in using a statute. So.
Well, thank you guys. Well, we're about 5.5 minutes from what was going to be the end of this, and I'm envisioning us, if we were in person, this would have, you know, more of you would have been willing to ask questions, so be it. You know, but then what would really happen, because it happens at every conference, right, is after you present, you get hounded when you're at the podium. Like, everybody wants to come up and ask the question that they didn't want to ask in front of everyone, or a nuance that they wanted to, you know, talk about privately. That's what we're here for 24/7. So the network is happy to respond to those through, you know, you can just shoot us an email, go to the network's website, and you can ask for technical assistance. You don't have to worry about who it gets routed to. It automatically will get routed to the right folks. Sometimes we collaborate across regions when that makes sense. Sometimes us in one region might be responding to your question, but you needn't worry about that. So for those of you who would be rushing up to the podium to talk to us, please do so through email or through the networks at request technical assistance button. And so I'm going to give you 5 minutes back in your day, which to me lately, every minute counts tremendously. So I hope you use it well, and we look forward to seeing you all tomorrow for the second day of the summit. Take care, everyone. And thank you for accommodating this, Brooke. We'll figure this out well before tomorrow. Sure. Take care.
Bye.
Bye.
And if everyone could please click the Take Survey and do a session evaluation, that would be great. It's on the Pathable site underneath the Q&A session led by Eastern Region Office. Survey links. Thanks.